I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsborough, and this is video number 2 in a series I'm doing showing you how to treat and get rid of your knee pain. You're here looking at video number 2 if video number 1 either didn't do anything for you, meaning it didn't make you better or worse, or if you'd done it for a few days and your improvements plateaued. Now you're going to be here doing this exercise, which is called knee extension in lying. So it's a forced progression of our previous exercise, which had been knee extension in sitting. So when we did knee extension in sitting, we were completely unloaded. Our foot was not touching the ground at all when we were extending our knee. Remember, extension is when we straighten the knee. In this case, we're still not weight bearing, but there is going to be a stronger extension force going through the knee. So in this case, you lie on your back, and I'm going to pull this up here a little bit. I'll keep it G-rated, no worries. I tighten the quad, and then I try to push the back of my knee as hard as I can into the mat or floor or bed, whatever you're on. So I flex and I push down. I hold 1 or 2 seconds, and then I relax. Flex, push down as hard as I can, hold 1 or 2 seconds, and then back. Yep, fire that quadricep muscle, hold 1 or 2 seconds, and then back, pushing down, fire that quadricep muscle, and then relax. Each time I'm trying to go farther into extension if I can, and then back off. Hold 1 or 2 seconds, pushing down, and then back off. And you're going to do that 10 to 15 times. Each time, try to get yourself into a little more extension. If it's a little uncomfortable when you do it, but as you do more repetitions, it doesn't get worse or it gets better, keep doing it. Now, if you had done that and it was a little too painful, then what we can do is put something to bolster up the knee so we're not in as extreme extension. But remember, usually you have to get to end range extension. End range is where the magic happens for most people. So if it was painful, put a little bolster there. Okay? And that way you're not getting to that end range extension. And now in this case, when you do this, same thing. Tighten the quad, push down, hold 1 or 2 seconds, and then relax. If that's still a little uncomfortable, put a bigger bolster in. Push down, you're firing that quadricep muscle, hold 1 or 2 seconds, and then relax. You just do it in a slow, rhythmical fashion, holding 1 or 2 seconds, and then back, and really trying to let that quadricep get activated as much as you can, and then back. Hold 1 or 2 seconds, and then back. Now, if you felt like you did have to do a bolster, do this for several days with the bolster underneath the knee, and then if your movement and your pain is better, then just by all means keep doing it that way. If it plateaus, then I would encourage you to try to remove the bolster. Or if you started with a thicker bolster, get thinner and thinner and thinner bolsters. Okay, so say you had to do it this way because it was just too uncomfortable without a bolster. You're doing your 10 to 15 repetitions, for 5 or 6 sets a day. You're getting better, but then you plateau. Then we're going to remove the bolster, and then you'll go back to this version. Okay, just knee flat on the table this way. 10 to 15 repetitions, 5 or 6 times a day. Now, if you don't get any better doing this, or you do get better, but then you plateau, then we've got to do a little progression here, a forced progression. In that case, now you're going to take the bolster and put it underneath the heel, this way. So that creates a little more space. You've got a little more room to move downward. Fire the quad, push down. So you're getting a little more extension, range of motion in this with your force. Same thing. I set my quadricep, and then I push, hold it 1 or 2 seconds, and then back off. Set my quadricep, push 1 or 2 seconds, back off. By set my quadricep, I just mean I'm flexing it, I'm contracting it. Contract, and then relax. Contract it, hold 1 or 2 seconds, and then back off. Each time, trying to go farther into my range. Again, if it hurts initially, but then as you do more, it gets better, keep going. If it's uncomfortable, but then when you get done and it's not worse, keep going. If you do it and it feels worse, you get more pain, you feel stiffer when you're done, stop. Don't do this exercise. Anytime you try these exercises, do a set of 10 to 15. 15 in this case might be better, but then try it out. So if you've had pain walking, walk around. Does it feel different? Do you have less pain when you walk? Does it feel like you're moving more freely when you walk? Did it hurt to squat? Test it out. Does it feel like your knee is moving more freely now with less pain? Did it hurt to step down or walk down the stairs, step off a curb? Try that. Walk down the stairs, walk up the stairs. Does it feel better? If it feels worse, don't do this exercise. Stop. If it feels better, then continue with this exercise. You're going to do 10 to 15 repetitions 5 or 6 times a day. Continue with the exercise as long as it's working. If it doesn't feel any different, I want you to do at least 3 more sets of 15 and then try it again. Okay? So you do 15, relax a little bit, walk around, do another 15, walk around. If it still doesn't feel better after 3 or 4 sets of this, then I want you to progress to the next exercise in the series. That's how we always do it. You've got to test it out, but don't just do 1 set. You're going to have to do more than that. Do at least 3 or 4 sets more before deciding whether this is helping you or not. I'm Sam Schroetke, Doctor of Physical Therapy with Physical Therapy and Hand Clinic of Hillsborough, and I've just shown you how to do knee extension in lying. The dosing for this exercise is 10 to 15 repetitions every 3 to 4 hours. So try to get 10 to 15 repetitions in 5 to 6 times a day. If you like what you've seen in this video, subscribe to our YouTube channel, click on the little bell, that way you're going to be notified every time we upload one of our new videos teaching you how to get rid of your pain. Like the video, share the video with your friends, and leave comments below. Let us know how this exercise worked for you. If it worked and it helped, let us know that, because we love hearing those stories. If it didn't work for you, let us know that as well, because then I can suggest a modification to the exercise that might make it more beneficial to you, or I can steer you toward another exercise altogether that might be more appropriate for you.